Hi, my name is Talia, and today I'll be taking you through a presentation about our client Julie. So to get started, a little bit about Julie is about 36 months ago, she went through a car accident where she suffered from a spinal cord injury. This in turn caused a great deal of pain and weakness on the right side of her body, also recurring lower back pain, and she uses crutches and wheelchair for mobility. After going through this car accident, she also suffers from PTSD, so post-traumatic stress disorder, where she often lives through episodes of recurring the event. So main goals that she has in mind is improving her walking kinematics, increasing her muscle tone and strength, and just overall getting out there, meeting new people, and she wants to try new exercise types. In general, from our subjective information, we found out that she lives independently. For full-time work, she is a computer programmer and she enjoys gaming after work as well. When asking about her sleep, she said that she often experiences disturbed sleep, which in turn gives her high levels of fatigue and tiredness. This kind of offsets into her work kind of life, where she often feels great deal of lack of motivation, and that fatigue kind of kicks in near the end of the day. In terms of her social interactions, they were really quite low. She did express to me that she had really good close support system with her friends and family, but often feels isolated. And she also feels that concerned for accessibility for getting out there. So moving on for exercise prescription and guidelines. For spinal cord injury, research used ESSA guidelines. So looking at the benefits of exercise, firstly, we found that there's improvements in cardiorespiratory fitness, muscular strength, overall independence, reducing pain and also depression symptoms, and overall just greater quality of life. In terms of the FIT principle, so we found that aerobic for 30 minutes at moderate intensities for 5 times a week, or 20 minutes at vigorous intensity for 3 times a week was quite beneficial. Resistance training as well, 2 times a week for 1 to 3 sets, 8 to 10 reps at moderate to vigorous intensities, and also flexibility to have shown to have these benefits. Now, moving on to for PTSD for exercise recommendations, looking at a variety of meta-analyses were very beneficial in grading in getting a good sense of what was beneficial for the population. So we found benefits of exercise for PTSD was to improve cognitive dysfunction, mind-body awareness, and reduce the risk of cardiometabolic concerns. Research also highly indicated that sleep quality patterns, quality of life, and depression symptoms were really beneficial for exercise for PTSD. In terms of the FIT principle, we found that frequency about 2 to 3 sessions per week with an overall time of 150 to 180 minutes of moderate intensity or 75 to 90 minutes of vigorous intensity was beneficial. Type ranged from aerobic resistance and multi-component. More research showing that yoga was very beneficial in terms of the mind-body awareness. So now moving on to some behavior change techniques. So for spinal cord injuries, we used again meta-analysis because they were the highest quality of evidence, mainly using the Watson paper. We found that the BCTs of social supports were specifically practical, adding objects to the environment, and also self-monitoring of behavior to be the highest BCTs that had the greatest effect size. We also found other research that supported social support again, goal setting, problem solving, and action plan to be beneficial for spinal cord injuries for behavior change techniques for physical activity. Moving on to behavior change techniques for post-traumatic stress disorder. Now, we did find quite limited research for BCTs for PTSD. So therefore, we might just use the spinal cord injury BCTs for when we're putting into plan. But we did find relative mental health papers that suggest that instruction on how to perform the behavior, social support, behavioral practice and rehearsal to be beneficial, but did involve other mental health concerns. So those are just ones to take into considerations, but mainly not be used. Looking into our plans to implement. So our plan A did show a variety of different aspects of the client goals, what will be mainly beneficial for the client, and what research also supported. So for exercise prescription, specifically for the spinal cord, we found that 30 minutes of moderate walking exercise about 3 times a week. This can be inside the clinic or outside of the clinic, would be beneficial for the client. This also relates to the client goal of walking kinematics, relates also to what research shows as being beneficial. In terms of the behavior change technique for spinal cord injury, we chose self-monitoring of behavior. So mainly looking at recording and monitoring online on an online document or checklist when they've completed their walk. The client expressed to me that they had the computer job, but also gaming. So this might be really a good mode of recording this kind of data. She can also include like the type of time or distance achieved during the walk, how she felt, if there's any onset of pain, and the walking quality. In terms of PTSD for exercise prescription, we found that participating in yoga class to be beneficial. So about 30 minutes to 45 minutes at a light to moderate intensity, about 1 to 2 times a week. The client did express that they did feel wanting to get out a little bit more, meet new people. So this might be a great mode of achieving client goals, but also was found to be very beneficial in research as a way to exercise for PTSD. In terms of a BTT for PTSD, we chose to invite a friend to participate in a yoga class together for social support. So this way the client is feeling comfortable during the session, and so she can get that social support. For our plan B, so in case plan A doesn't go to work, we did choose a variety of other aspects that we can kind of target. So for spinal cord injury for exercise prescription, we chose to participate in 30 to 60 minutes of resistance training at a moderate intensities for two days per week. So this kind of relates back to more of the client goals of wanting to improve their walking kinematics. Also in research, resistance training was shown to be very beneficial in improving muscle mass, muscle tone, but also just in terms overall better quality of life. In terms of BCTs for the client for spinal cord injury, we chose also again spinal support, social support. So this will be more participating in group resistance training. So in the clinic would be very beneficial as they might have experienced some similar experiences or other types of conditions. So they can kind of get that additional information, but also be able to kind of relate to other clients too. So for PTSD for exercise prescription, we're looking at incorporating like maybe a multi-component program, still at the 30 to 60 minutes at a moderate intensity for 2 to 3 times a week. But we're looking at more of like a Wii Sports or computer-based game. The client expressed that they do enjoy gaming, so this could be a very enjoyable kind of mode of exercising for the client, very individualized. And that way they can also do this at their house. So if they are expressing overwhelmed feeling that they have done in the subjective intake, that way they can be comfortable during their own house. For BCTs, we're looking at adding objects to the environment. So probably keeping a video game controller close that is accessible for them to regularly see, and kind of prompt them to complete this multi-component program. So these were the references used for this presentation. To give basically an overview, we're looking at exercise prescription for both the client factors, so for PTSD and spinal cord injuries, but also ways BCTs to kind of keep them adherence to the program itself. We've seen plan A and plan B as well that we can incorporate to like their regular activity and regular life. Thank you.